I'm here with Roberto Ascione. Did I pronounce that correctly?
Right.
All right. He is the CEO of Healthware's, a Healthware group in Europe, and he's also one of the leaders of Frontiers Health, and has advised health tech in Europe for how long?
As Healthware, we have been around for the past 20 years.
Okay.
And of course, very much into digital health since 10.
Okay.
And Frontiers Health, it's up and running since 4 years now.
Okay. So this gives you a unique vantage point to understand the trends of digital health in Europe. So we asked you here to give us your 10,000 foot view of where digital health is heading in Europe.
Yeah, I think it's at a great moment. It's clearly maturing.
Mm-hmm.
There's been a lot of progress over the last 3 or 4 years. The key things, we reached probably in the last couple of years a good level of available funding.
Mm-hmm.
So I think the early stage is fairly well covered. And we are starting to see also some more traction. I think companies have learned that Europe, it's clearly an interesting market to go.
Mm-hmm.
A few years ago, it was a little bit funny. You had companies that in the very early stage, starting to get a little bit of traction, were looking to move to the US, which of course is a much different game. And some made it, but many, many others did not. So I think what's really new is that in Europe, we created the conditions for companies to kind of thrive in the local markets. Companies learned, as I was saying before, that Europe can be a viable market. Each country, the main ones, are pretty decent healthcare markets. Think about the UK, France, Germany, Italy are pretty sizable markets. And I think another key development has been that this company have learned that it's much better to be strong in one market first, and then understand what are other markets that they might attack, not just maybe the nearby ones, but more those that from a user dynamic and business model perspective could be more kind of suitable. So I think this kind of general conditions and this kind of learnings that the founders have in some cases learned the hard way has created a kind of environment that now it's allowing a few companies, or several companies I should say, to really kind of thrive and scale and raise more funds.
Okay. So you've said the conditions have changed. What are some specific ways that the conditions have changed so that traction, so you've seen the kind of traction that you have?
Yeah, so I think a few different things. So on one side, the availability of early stage funding in multiple countries, of course, has been important. A generation of entrepreneurs that started to cultivate more digital health in a much more kind of wise and organic way, of course, has been very important. There's much more general attention by the different stakeholders.
Why do you think that is?
Well, I mean, first because they've been observing clearly the US dynamics. Okay. So the ecosystem in Europe is probably, I would say roughly, it was several years behind, has been catching up quite fast, so it's still a bit less developed than over here, but clearly this kind of mirroring effect has been playing a role. Look at Frontiers. When we started 4 years ago, Frontiers Health, as the health vertical of the Frontiers conference, that has been for the past, say, 10, 12 years in Europe, really talking about innovation. When we did start and they asked me to lead this as chairman, basically the movement was really in the beginning. So the conference itself as a place for the ecosystem to kind of meet and mingle, also probably contribute a little bit. When you look at the conference last November, where you guys had a full kind of breakout with the sort of mini festival, as we said, with Unity, European version, was really successful. It's now a 600 people, event. All the stakeholders, insurance, pharma, so all the life sciences investors are clearly startups. When you look at 4 years after, it's really night and day. Because of the size of the companies, the level of maturity, the products, the traction they're gaining on the market. And in fact, we're also starting to see the first acquisitions. So in Europe, we had now nearly 2 years ago, the My Sugar by Roche. Recently, we had the Nuna Bavarian just a few weeks before the event, and they were speaking at the conference. So I think we are also starting to see, we had volunteers doing the IPO in the digital therapeutics space. So I think we are starting to see also some kind of path to value and some early exits. Clearly, it's just the beginning, but I think this is contributing, to kind of encourage all the ecosystem to develop.
Yeah, you mentioned this idea of a mirroring effect and the European market being a couple years behind the American market. Does that open up an opportunity to see what has been tried and maybe even leapfrog over mistakes that have been made? Does that actually create a new opportunity?
I'm very in favor of this, and this is something that I think is not only happening in some cases, but I think it should happen as much as possible. Now, the markets are different, so it's not that all the learnings can be just kind of, imported, so to speak, in Europe, because the systems are fairly different. But certainly from an entrepreneurial perspective, whether it's on the founder's side, the way you basically work on the capital side, the way you work, especially in the large corporations, there's a lot of learnings that can be kind of mutuated from other markets. And there's a beauty to be first, I think, but there's also a beauty if you know how to play the game, to be a follower, because you can learn, and kind of leapfrog a number of mistakes that maybe have been done. So it's not everything because of the difference of the systems, but I think there's a lot, and this is also part of what we do when we work on projects. We have a fairly substantial operations as Healthware also in the United States. And our innovation division, for example, Healthware Labs, which works with the large-scale corporates and startups to kind of do innovation management and kind of fast-track products, that was started not by chance in the States. And then we basically moved back in Europe, even if the company was originally founded in Europe. So I think there's a great value in this. And I believe it will happen the same with Far East, with China especially. It's very different again as a system, but again, there are a lot of things that can be mutuated.
As a healthcare consultant, you're under the hood, you're understanding the mechanisms that make digital health work, and yet with the moonshot approach that we have, it always comes back to this personal motivation or this desire to see change. We're celebrating moonshots from trying to end cancer to rolling out this new opioid addiction moonshot. Is there a moonshot that really speaks to you personally, that sort of gives you motivation to do the work that you do?
Yeah, I mean that's interesting, and I'm very familiar with the moonshot concept since the Ignatian. I'm very passionate for anything that is able to increase impact and humanize care through the technology. So my whole work, since I was studying medicine back more than 20 years ago.
You were a practicing physician?
No, I've been studying medicine, but never practiced because I studied with the idea to basically work in this convergence of medicine and digital, because I was polluted early on with both sides. So for me, digital health is really like very personal to me, because it kind of nicely marries together my two main life interests. And the reason behind Healthware itself and the work we do with entrepreneurs, which can be physicians, can be nurses, can be other professionals coming from all different angles, it's really the overall idea is really that technology, as happening in other sectors, can democratize healthcare. That we know a lot. We need a lot of that. And finally, by removing complexity, by removing waste of time and data, will allow the different players to gain back time to have more relationship with patients. So my whole idea is that tech will at some point start to kind of disappear, increase efficiency, improve impact, and making healthcare a lot more human by making it sustainable. Because as we know, the systems are largely unsustainable regardless of the country. So that's basically what moves myself, my team, which is now over under 50 people, all basically working on these concepts.
What do you think is a big misconception about healthcare in Europe? A lot of people around the world really put healthcare in Europe on a pedestal and look at the Scandinavian countries and the happiness indices, and they see it as an ideal in terms of how healthcare is handled. I know people in the United States who see it that way. Are there misconceptions or things that people should know about European healthcare in general?
Well, that's a broad one, but in essence, yes, healthcare is extremely good on average in many European countries.
Yeah.
And I can even speak for Italy. So the national health system is turning 40 years old this year, is universal, provides access to care to everyone that is on, in the country, basically, for any reason. And the average level is incredibly high.
Yeah.
Life expectancy is, at the first, is among the first in the world. And the system works really well on average. The issues with those kind of systems is that, which is probably true in many other systems, is that the quality of the care can vary significantly from, point to point, which is where I think technology can help for sure. And also, there's a general concern about the sustainability of the systems on the medium long term. With the aging population, with absolutely appropriate desire for people to access the best care option possible, regardless geography or regardless, income, which I think it's absolutely correct. The systems are under pressure and will be under more pressure. So I think Europe and some countries especially are in a unique position to kind of amplify the pockets of excellence they have in the various healthcare systems. And in that case, I think ideally, we in Europe should be using technology to kind of level the play field and give and kind of rise the bar of the care to larger population. Because the average is good, but it might vary a lot.
Yeah.
So I think tech can help with that.
Yep.
And will certainly help to control cost, because the cost is high and is hidden because the lot is social medicine.
Yeah.
But if we don't handle costs, that will have to change in a very different kind of system. And I think the hybrid, if not controlled well, might be dangerous.
Yeah.
So I think this transition to a sustainable system will have to be done in a smart way. And I think tech-driven will be the answer.
All right. Thanks for taking the time to
Thanks
talk.
for having me.
And thanks for the work you're doing.